23, and I'd been feeling kind of under the weather for quite a while. Kind of needed to go to the toilet a lot. I had a lot of kind of symptoms of high blood sugar, I suppose. I didn't know that that's what it was at the time. I eventually went to the doctors and was diagnosed with diabetes. When I first found out, I wasn't really sure because I didn't know a lot about diabetes. I'd heard about it, but I didn't really understand what it was. And I suppose it was just a big lifestyle change in terms of like the way I was living my life and the way I was gonna have to start living my life. At the moment, it's just I just have to like be really careful, manage my lifestyle and eating habits, make sure I don't drink diet drinks, things like that, just to keep my blood sugar at a good level. I mean, I was always had a bit of a sweet tooth, which like sometimes I succumb to now, but yeah, I just had to like kind of really manage my eating, and because I hadn't had to do that for my whole life, it was a really big change for me. And then things like alcohol as well, like a lot of my friends go out drinking, so you have to be careful on how much you drink and stuff. And yeah, just remembering to order like diet drinks when you're in the pub rather than regular drinks when you have to make that change so late on in life was I always found it quite difficult, I suppose. At first I didn't do a lot of exercise or anything like that, but kind of I realised how much kind of better you can feel if you do exercise, eat the right foods, and yeah, I suppose the more exercise and kind of healthy lifestyle you have, the kind of like you can treat yourself occasionally, I suppose, and try something a bit sweet. Yeah, at first I thought I could just do everything by myself, but it was quite nice. Went on a course, the health exchange, where just a lot of other people in my situation. If you were a bit older, if you were kind of similar age, it was quite nice to be around other people with type 2 diabetes, because I hadn't really met many others since I had diabetes. And you just kind of learn things off each other, talk about kind of things that you do well, things that you don't do well. And yeah, it's just a nice situation to be in, because you don't really go out with your mates and go say, let's talk about our diets today. So it's much nicer to kind of do that with other people who like share your condition, really. I'd say don't worry too much. It's not if you manage it right, then it doesn't kind of affect your life too much, I suppose. Although it seems like a big change, just kind of do what the doctors say as well, I suppose, because they are right. At first I didn't really think I would have to stop drinking so much and eat all the right foods, but I found since I have done that, it's really made a difference in my life, because I felt a lot better, I felt a lot healthier and stuff. Appointments, go and see my doctor regularly, and he can check out my blood sugars that I keep a diary of, and also have I think it's called a HbA1c, which is like a big blood test. I've then done every 6 months now, because I've got a kind of decent amount of control. It used to be every 3 months, and yeah, so they can kind of tell your blood what it's been kind of on average over the past 6 months. I was just trying to keep that between about 4 and 7 really, and then hopefully I shouldn't have any of the health implications or health issues that could arise if I had a higher blood sugar. Mainly just worried about kind of the health implications that can have later on in life, because now kind of might feel a bit sick occasionally because I haven't looked after my blood sugars, but if you don't look after your blood sugars properly long term, it can affect your eyes and it can affect your feet, and you know, kind of becoming a diabetic was quite a lifestyle change, but going blind would be, you know, a massive change. So it's important to always go to the eye appointments that I go to, and just making sure I look after my blood sugars, because if I don't, then I could go blind, which would affect my work and things like that as well. If I suppose when I wasn't looking after it so well and I felt sick a lot, then you wouldn't really want to go out or kind of socialise or anything like that. But if you're looking after yourself, then you know you can still live the pretty much normal life, just remembering to eat right, I suppose.